Baby-Friendly Initiative Project Evaluation Report Overview 2019 to 2023. This presentation's objectives is to provide an overview of the BFI project with a focus on the National Baby-Friendly Initiative Quality Improvement Collaborative Project, also known as the BFI project, to share the impact of the Baby-Friendly Initiative, and to discuss the sustaining momentum and expanding the reach of the Baby-Friendly Initiative. In 2018, the Breastfeeding Committee for Canada received grant funding from PHAC Centre for Health Promotion to scale up the implementation of the Baby-Friendly Initiative and thereby improve breastfeeding rates and maternal-infant health. Thank you to the Public Health Agency of Canada Centre for Health Promotion for the funding support to make this project possible. We also acknowledge the support from the Health Standards Organization, Breastfeeding Committee for Canada members, and the participating hospital teams and partners across Canada. The Baby-Friendly Initiative was launched by WHO in 1990 to protect, promote, and support breastfeeding. It includes 10 steps to successful breastfeeding with evidence-based best practices to support maternal care. BFI supports informed decision-making and is for all mothers regardless of their infant feeding decision. BFI goes beyond healthcare service provision. It is part of the continuum of care to help children have a healthy start in life. The World Health Organization states, exclusive breastfeeding is a cornerstone of child survival and child health because it provides essential, irreplaceable nutrition for a child's growth and development. It serves as a child's first immunization, providing protection from respiratory infections, diarrheal disease, and other potentially life-threatening ailments. Exclusive breastfeeding also has a protective effect against obesity and certain non-communicable diseases later in life. Exclusive breastfeeding to 6 months has the single largest potential impact on child mortality of any preventative intervention. For over 30 years, peer-reviewed evidence has documented that the Baby-Friendly Initiative is linked to improved health outcomes for the infant and the birthing parent, and it is linked to cost savings to the health system. Despite this evidence, the implementation of the BFI has been slow. Several studies have documented the barriers to achieving baby-friendly, but few projects have identified successful strategies to implement BFI. The BFI project goals are A, to update the Baby-Friendly Initiative in Canada to reflect WHO guidance. B, to adapt, implement, and evaluate a national BFI quality improvement collaborative that promotes the uptake of best practices in maternity and newborn care. C, to coordinate the development of a communication strategy to raise awareness of the Baby-Friendly Initiative. D, to enhance public education and awareness. In 2018, the World Health Organization and UNICEF called upon all nations to scale up the implementation of BFI. After consultation and public engagement, the BCC released a baby-friendly implementation guideline in 2021. This guideline provides the standards and criteria for maternity services to meet evidence-based BFI practices in Canada. In addition to the BFI implementations guidelines, the BCC updated tools and resources for maternity services to assist them on their BFI journey of implementing best practices using QI strategies. Breastfeeding statistics and trends can be found on Health Canada's website and more recently in PHAC's Breastfeeding Report for 2022. This report is important for us to see the trends over time and our progress. The global targets set for breastfeeding include increasing the rate of exclusive breastfeeding for the first 6 6 months to at least 50% by 2025 and to 70% by 2030. 91% of mothers initiate breastfeeding in Canada, with lower rates in certain populations, especially for First Nations, Métis, and Inuit populations. The decision to breastfeed has become the norm, but 2 days after birth, only 55% of mothers are exclusively breastfeeding, and at 6 months, only 34.5% are exclusively breastfeeding. The 91% reflects effective population health messages, yet the dramatic decline happens before hospital discharge. This primarily reflects the lack of evidence-based organizational policies and healthcare practices. We have a ways to go to reach the global targets. To address the rapid decline in breastfeeding exclusivity from birth to discharge from hospital, a focus for the most recent BFI project was on hospital best practices. It was a hospital-based project because it sets the trajectory of best practices and health promotion for maternal infant health. A national baby-friendly quality improvement collaborative project recruited and engaged 25 hospital teams across Canada. The overall purpose was to scale up BFI implementation by increasing the number of hospitals that fulfill the 10 steps to successful breastfeeding, increase the number of hospitals that are designated BFI, increase the number of births that occur in a BFI hospital, and increase the breastfeeding exclusivity rate during hospital stay. Implementing and sustaining evidence-based care practices involves ongoing change. This change journey is not easy or quick, but we have a global maternal health promotion tool in the Baby Friendly Initiative as our roadmap. The vehicle for change includes QI models and tools. All this is supported by an investment and commitment at all levels to be successful. The support and funding from PHAC is helping to strengthen BFI in Canada. 9 provinces and 1 territory across Canada participated in the BFI project. You can see the breakdown of the participating teams in the green circles. The blue stars represent the number of facilities already designated BFI in Canada. The participating facilities impacted 42,000 annual births, or 11% of Canadian births. Over the past decade, projects have emerged that applied a collaborative approach built on the IHI Breakthrough Core model that resulted in improved care provided to families. The BCC took this emerging evidence and built one of the first and largest multi-jurisdictional national baby-friendly quality improvement collaborative project with 25 teams. Teams worked collaboratively over 30 months using quality improvement strategies. The BCC supported an all-teach, all-learn environment. Key activities included 3 workshops and action phases between the workshops to implement improvement strategies. In addition, the BFI project included monthly webinars, team-specific reports that summarized each team's progress on key indicators, one-on-one coaching, and additional supports as needed using a virtual platform. People-centered care and cultural safety were incorporated throughout the project. 2 parent partner leads participated in the BFI Project Advisory Committee, actively supporting over 20 parent partners from each participating team. Leaders engaged in a national leadership track and met monthly to learn and share with each other. Leads also supported their local teams to set goals, address barriers, communicate progress, and recognize success. Engagement from parents and leaders enhanced the motivation and commitment towards BFI implementation. The measurement strategy included teams completing their annual BFI self-assessment using the BCC BFI implementation guideline, monthly collecting and analyzing chart audit data on BFI indicators, completing intermittent surveys of mothers' experiences and staff competency. We also evaluated the processes related to the BFI Project Collaborative. Teams noted that data collection, i.e. chart audits, run charts, revealed areas of strength and success, discovered practice concerns, and identified charting deficits. All teams experienced improvement in at least one of the measurable BFI indicators. Some teams surpassed milestones across all targets. Chart audit data, survey data, and results from document analysis of presentations all show that as a result of this project, families giving birth in BFI project facilities were more likely to receive the care outlined in the BFI at the conclusion of the project at the end of 2021 when compared with families giving birth in these same facilities in 2019. Breastfeeding exclusivity is known to be a lagging indicator, and considerably more time is needed where facilities experience improvement in these care practices before changes in exclusive breastfeeding are observed. When compared with other quality improvement initiatives focused on achieving baby-friendly designation, the improvements experienced by this project are exceptional. 118% improvement in the proportion of families receiving assistance and support for breastfeeding within 6 hours of birth. 90.4% improvement in rooming in. 82.8% improvement in skin-to-skin within 5 minutes of cesarean birth. 73.3% improvement in skin-to-skin for at least an hour after cesarean births. 46.1% improvement in practicing skin-to-skin for at least an hour after vaginal births. All these achievements occurred against a backdrop of a global pandemic that diverted resources in all facilities to support the COVID-19 pandemic response. Staff members were redeployed from BFI project activities to respond to the pandemic, and there was a 50% turnover of leadership. The BFI project had to pivot to virtual activities as opposed to in-person workshops. Parent partners were heavily restricted from entering or visiting facilities to meet with teams and participate in hands-on work. Early during the pandemic, there was uncertainty about recommendations for breastfeeding if a mother was COVID-19 positive. And teams lagged behind in supporting their data and completing the PDSA activities. To address the challenges, all BFI project activities transitioned to virtual platforms, and the project timelines were extended. BCC leaders partnered with national health agencies and societies to generate and disseminate evidence-informed messaging for infant feeding during COVID-19. Communication with teams and CEOs were aimed at soliciting continued commitment to the BFI project. Select teams were invited to share their critical success factors through a harvest session. Teams shared that a collaborative and engaged community of partners was key to success. They were able to tap into the lessons being learned across Canada, troubleshoot challenges together, and collaboratively work together. Quality improvement structure and strategies was foundational. Prior to this BFI project, facilities reported being isolated in their efforts to pursue change. The BFI project created a national Canadian network that participating facilities were able to tap into. Teams reported that for the first time, they were able to get direction at the regional level that put them into alignment across Canada for how to pursue the quality improvement changes necessary to become baby-friendly. The leadership track was vital to keeping management engaged. Teams noted that the leadership track was instrumental in obtaining and maintaining the buy-in of facility leadership for the BFI project and pursuing baby-friendly designation. The Parent Partner Network supported a community culture for breastfeeding. Parent Partner Network helped to foster this expectation in the community and normalize breastfeeding, influencing both community and hospital culture. The Parent Partner Network also centered the voices of families in this change initiative, which served to increase collective commitment amongst teams. Overall, the BFI project was successful. BFI designation was achieved by 2 teams during the project timeline. 8 teams are actively pursuing BFI designation, and all 25 teams are working towards implementing the BFI 10 steps. In October 2022, the BFI project was recognized by Health Standards Organization as a leading practice. Building on the momentum from the BFI project, in April 2022, the BCC launched the BFI Coach Mentor Program. The Coach Mentor Program is open to hospitals and public health units across Canada. We are using similar quality improvement approaches to achieve best practices and supporting an interprofessional team with engaged parent partners. Again, with an overall goal to improve maternal-child health by increasing breastfeeding rates. 45 facilities are currently enrolled and momentum is increasing. We are implementing and evaluating the Coach Mentor program, and we have joined up the BFI activities with the BCC Provincial Territorial Committee to broaden the reach of BFI implementation. We also continue to expand our communication, education, and support. Dr. Tam has been a great supporter of breastfeeding and this BFI project. At the beginning of the project, Dr. Tam stated, "Advocating for breastfeeding as a healthy start for babies and as a larger public health issue is a priority for me and for the Public Health Agency of Canada. Research confirms that exclusive breastfeeding for the first 6 months of life offers significant benefits and protection. The Baby-Friendly Initiative plays an important role in encouraging and supporting breastfeeding and in strengthening maternal and child health in Canada." Dr. Tam reiterated her support for the importance of breastfeeding and BFI during the opening of the 2021 BFI Symposium and congratulated the BCC for adapting and being innovative to support mothers and young children during the pandemic. We are honored to have such leadership and commitment from PHAC, and we look forward to future work together to promote a healthy start for children and families in Canada.